Have you ever pondered what it would be like to perceive reality in a completely different way, perhaps in a way that others might deem abnormal or even impossible? Welcome to the world of schizophrenia. This intricate mental health disorder alters the way a person thinks, feels, and behaves. It's a complex, long-term condition that distorts reality, affecting millions across the globe. In the next few minutes, we will delve into the causes, symptoms, and treatments of schizophrenia. Schizophrenia, like many mental health disorders, does not have a single, identifiable cause. Peeling back the layers of schizophrenia's mysterious origins, we find ourselves in a tangled web of genetic, physical, and environmental factors. It's a puzzle that the brightest minds in the field are still trying to piece together, and every new discovery only adds more complexity to our understanding of this disorder. Let's start with genetics. It has been observed that schizophrenia sometimes runs in families, suggesting a genetic component to the disorder. However, it's not as straightforward as inheriting a certain gene and developing schizophrenia. Many people with the disorder have no family history of it, and vice versa. It's more likely that a combination of several genes increases a person's risk, rather than a single schizophrenia gene. Now on to the physical aspect. Brain scans of individuals with schizophrenia often show differences compared to those without the disorder. There's evidence of subtle changes in brain structure, such as decreased gray matter, and differences in the way certain brain regions connect and communicate. And then we have the role of neurotransmitters, the brain's chemical messengers. Imbalances in two of these, dopamine and glutamate, have been linked to schizophrenia. Dopamine is involved in regulating mood and reward, and glutamate plays a key role in learning and memory. Imbalances in these chemicals can disrupt the way information is processed in the brain, potentially contributing to the symptoms of schizophrenia. Lastly, let's touch on environmental factors. Certain experiences, such as exposure to viral infections in the womb, malnutrition before birth, or psychosocial factors like childhood adversity, are thought to interact with genetic and physical factors, increasing the risk of schizophrenia. So you see, the origins of schizophrenia are far from simple. Each individual's experience with the disorder is as unique as the combination of factors that contributed to its development. While the exact cause remains unknown, it is clear that schizophrenia is a complex interplay of various factors. Schizophrenia is often characterized by an array of symptoms, which can be broadly classified into three categories: positive, negative, and cognitive. Let's start by breaking down the positive symptoms. These are the ones that most people associate with schizophrenia, as they add something to the person's experience. Hallucinations are a prime example. Imagine hearing voices or seeing things that aren't there. It's a frightening concept, isn't it? Then there are delusions, where the person holds firmly onto false beliefs despite clear evidence to the contrary. Thought disorders are another positive symptom, where the person's speech and thoughts may be disorganized and hard to follow. Now onto the negative symptoms, which are a little trickier to understand because they involve the absence of normal behaviors. Diminished emotional expression, for instance, can make a person appear emotionless or detached. Avolition, or lack of motivation, can make it difficult for someone to start or finish tasks. These symptoms can sometimes be mistaken for laziness or a lack of interest, but they're really part of the illness. Finally, let's delve into the cognitive symptoms. These are issues that affect how the person thinks. Problems with executive functioning can make it hard for someone to plan and execute tasks. Trouble focusing or paying attention can make it difficult to stay on track, while problems with working memory can make it hard to use information immediately after learning it. These cognitive symptoms can be particularly challenging because they can interfere with everyday tasks, like managing money or maintaining a job. One important thing to remember is that not all people with schizophrenia will experience all these symptoms. Some might have more positive symptoms, while others might struggle more with negative or cognitive symptoms. And the severity of these symptoms can also vary greatly. For one person, hallucinations might be a rare occurrence, while for another, they might be a daily struggle. Understanding these symptoms is crucial because it helps us empathize with those living with schizophrenia. It's all too easy to dismiss these experiences as crazy or strange, but they're really part of a complex and often misunderstood illness. So when we talk about decoding the symptoms of schizophrenia, it's not just about understanding the medical jargon. It's about gaining a deeper understanding of the human experience behind the diagnosis. The appearance and severity of these symptoms can vary greatly, making each person's experience with schizophrenia unique. Despite its complexity, schizophrenia is not a life sentence. Effective treatments are available. The road to managing schizophrenia is paved with various treatment options, each tailored to the unique needs and circumstances of every individual. The cornerstone of schizophrenia treatment is medication, specifically antipsychotic medications. These drugs are designed to control symptoms by affecting the brain's neurotransmitter systems. They help manage hallucinations, delusions, and disordered thinking. However, like any medication, they may have side effects. It's important to have an open and honest discussion with the healthcare provider about the benefits and potential risks. But medication is just one piece of the puzzle. Psychosocial treatments are equally significant, particularly when combined with medication. These treatments help individuals deal with the everyday challenges of schizophrenia, such as difficulty with communication, self-care, work, and forming and keeping relationships. Cognitive behavioral therapy, for instance, can help a person change harmful or unhelpful thought patterns. Social skills training can enhance their ability to interact more comfortably with others. And vocational rehabilitation and supported employment can help them find and keep a job. Coordinated specialty care, or CSC, is a relatively new approach that has been gaining ground. This treatment model integrates medication, psychosocial therapies, case management, family involvement, and supported education and employment services, all aimed at reducing symptoms and improving quality of life. CSC is team-based and personalized, taking into account the patient's goals and feedback. It's a comprehensive package, and studies have shown it to be particularly effective when started early, shortly after the onset of symptoms. Then, there are self-management strategies and education. Being an active participant in one's own treatment is crucial. Self-management strategies may involve learning about schizophrenia, managing symptoms, making a crisis plan, and focusing on personal recovery goals. Education not only empowers the individual, but also their family and friends. Understanding the nature of the condition, knowing how to manage symptoms, and being aware of the triggers can make a significant difference in the person's journey towards recovery. Lastly, let's not forget the importance of a supportive environment. A strong support system, whether it's family, friends, healthcare providers, or support groups, can play a pivotal role in the treatment process. They can provide emotional assistance, help manage symptoms, and assist in navigating the often complex world of healthcare. The effectiveness of treatment can vary, but the majority of people with schizophrenia can lead fulfilling and meaningful lives with the right support and treatment. The path to treatment isn't a one-size-fits-all. It's a journey that's unique to every individual, requiring patience, resilience, and hope. After all, schizophrenia is not a life sentence. It's a condition that can be managed with the right approach, the right treatment, and the right support. So let's recap what we've learned about schizophrenia. This is a mental disorder shrouded in mystery, with origins that are still being unraveled. We've delved into potential causes, such as genetic predisposition, environmental factors, and chemical imbalances in the brain. Each of these elements can interplay in complex ways, contributing to the development of schizophrenia. We also explored the diverse range of symptoms that can manifest. Some people may experience hallucinations, hearing voices, or seeing things that aren't there. Others may have delusions, holding on to beliefs that are not based in reality. Disorganized thinking, reduced social engagement, and emotional flatness are also common. These symptoms can be incredibly disruptive, making day-to-day life a challenge. However, it's important to remember that schizophrenia is not a life sentence. There are treatments available that can help manage these symptoms and improve quality of life. Antipsychotic medications can help reduce hallucinations and delusions, while cognitive behavioral therapy can help individuals navigate their thoughts and behaviors more effectively. Supportive therapies, such as vocational training and social skills training, can also play a vital role in helping individuals with schizophrenia lead fulfilling lives. In our reflection, we must remember that everyone's experience with schizophrenia is unique. The variety of symptoms and the effectiveness of different treatments can vary greatly from person to person. This is why it's crucial for healthcare professionals to approach each case with an open mind, and for us to extend our empathy and understanding to those living with this condition. Schizophrenia, like many mental health conditions, is a testament to the intricate complexity of the human mind. It serves as a reminder that our brains are wonderfully complex organs, capable of creating experiences that are deeply personal and unique, but also susceptible to conditions that can profoundly alter those experiences. In understanding schizophrenia, we are reminded of the complexity of the human mind and the importance of empathy and understanding for those living with this condition.